Okay, I have a patient, Leandria Taylor, that I'm gonna do a head to toe assessment on, so we're gonna go in and assess her.
Come in.
Hi.
Hi.
I'm Savannah, I'm the student nurse today. How are you doing?
Good, how are you?
Good. I'm here just to do a head to toe assessment on you. Is that okay?
Mm-hmm.
Alright, so I'm gonna give you some privacy here. Alright, and then can you go ahead and tell me your name and date of birth?
Leandria Taylor and 10908.
Perfect. Alright, do you mind if I use your bedside table?
Mm-hmm.
Okay. I'm just gonna set that here. And then I'm gonna go ahead and kind of get you lifted up here. And then I did see that you had some food allergies. Is that still correct?
Mm-hmm.
Yeah, can you tell me what those are?
Peaches, pears, pineapple, strawberries.
Awesome. And do you have any allergies to latex, betadine, iodine, adhesives, or anything in the environment?
Mm-mm.
No? Okay. And then do you have any spiritual or cultural beliefs that I need to be aware of before we get started?
No.
No? Any psychosocial needs?
No.
No? Okay. So I'm going to go ahead and I'm going to start with your vitals. So I'm going to take your heart rate, your pulse, your respiration, your O2, and your temperature, okay?
Okay.
Right. And then are you in any pain today?
Mm-mm.
No? Okay. Put that on your finger there. While that's going, go ahead and take your temperature. 98.8. And your O2 is at 97. Okay. We'll lower this a little bit and we'll go ahead and take your blood pressure. That was 100/64. And then are you feeling okay?
Mm-hmm.
Yeah, any lightheadedness, tingling, numbing? Okay. Alright, so I'm gonna go ahead and get my stopwatch out. I'm gonna go ahead and check your pulse, okay? and just breathe normal for me, okay? Your respirations were at 12. Okay. We'll go ahead and get those moved out of the way. So we're gonna start our assessment now. So I'm gonna go ahead and just gonna check your head and just kind of work all the way down to your toes, okay? All right. So I'm gonna go ahead and Jen, you're kind of tall. Okay, I'm gonna go ahead and check your scalp here. You have no bumps, lumps, or anything like that. Have you hit your head recently? No? Okay. And then your hair is evenly distributed, and your skull is symmetrical. And then when I was pushing on it, did you experience like any tenderness? No? Okay. And then when I go into your ears, do you have any tenderness there? No? Okay. And then when I go up into your sinuses, do you experience any tenderness there? No? Okay. Let's check your lymph nodes here. Your heart is beating, which is good. All right, and then do you have any, have you been experiencing any drainage in your ears at all? No? Okay, so I'm gonna take a quick look here. All right, well the skin around your ears look intact. There's no redness, no rashes, or any wounds. It's not, they're symmetrical to your face. And then your eyes, your nose, and your mouth are all symmetrical to your face, as well as your trachea, which is good. Your lymph nodes look good and they're not hard or anything like that. And then your carotid artery, we're strong on both sides. So I'm gonna go ahead and just take a look at your eyes. I will be shining a bright light, is that okay? All right, so I'm gonna go ahead and have you close your eyes really quick. Okay, well you have no swelling of your eyelids at all. So I'm gonna have you go ahead and just open them and look up at me. Well, they are dilating like they're supposed to. And pupil size, I would say about a 5. So I'm gonna go ahead and just have you look at my pen here, and I'm just gonna have you follow it, okay? Perfect. Well, that looked good there. You didn't have any strabismus or like a lazy eye or anything. Do you wear contacts or glasses at home? No? Okay. And then have you been experiencing like any drainage in your eyes? Alrighty. Well, your sclera does look nice and white, and you have kind of like a greenish color eyes. Is that normal? Yeah? Okay. So I'm gonna go ahead and kind of move down into your nose and your mouth. Are you experiencing any nasal congestion? No? Okay. I'm gonna have you go ahead and just kind of lift up here. Lovely. Well, you have no drainage, no boogies. Your septum is nice and even. How often do you go to the dentist?
Twice a year.
Twice a year. And then how often do you brush your teeth?
Twice a day.
Twice a day. Perfect. I'm gonna have you open this way. All right, and stick your tongue out. All right. Well, your uvula is nice and pink. There's no swelling, and it's in the middle. Your tongue and your lips are nice and pink, and no cracks or anything like that. So I'm gonna go ahead and I'm going to check your back really quick. I'm just gonna look at your spine and palpate and then we'll kind of move down into your chest, okay? So I'll have you sit up here. All right. Well, your spine is nice and straight. And then when I push on you, do you have any tenderness? No? Okay. Well, I don't feel any lumps or anything like that. So I'm gonna have you sit on back. And then on your chest, do you have any wounds or scars or redness that I need to know about? Any bruising? Nope, okay. So, go ahead and, does this hurt at all when I do that? How about down here? And then over here? Nope, okay. So I'm gonna go ahead and I'm going to listen to your lungs, okay? So I'm gonna have you breathe in and out. In, out. In, out. In, out. Lovely. Okay, can you sit up for me for a second? I'm gonna have you breathe in, breathe out, breathe in, out. All right, breathe in, out, and last one here. Breathe in and out. Okay, go ahead and have us lay back there. Do you experience any shortness of breath at all? Any pains in your chest? Nope. Okay. And then do you do like monthly or every few months breast exam? Okay. Afterwards, if you would like to know more about that, I can definitely come back and teach you about that if you want to, okay? So I'm gonna go ahead and I'm gonna listen to your heart sounds as well, okay? All right. Okay, so I'm gonna listen to your aortic. And then your pulmonic. And then your Erb's point. And then I'm just gonna lift up a little bit, okay? Your tricuspid. And listen to your mitral. well, that looked really good. And then I checked your mitral pulse as well, and that was pretty in line to your heart rate that when we checked your radial, and so that was also at an 85. Alrighty, so we're gonna go ahead and I'm going to look at your arms. So I'm gonna have you kind of hold them out here. Okay, well, your skin color is nice and even, no redness, no lumps, no bumps. I'm gonna go ahead and have you squeeze my hands. Lovely. And then I'll have you push down. Okay, and then push up. And then push me away. Perfect. Okay, you are nice and warm to the touch. Okay, and then can you feel that? And then can you feel this? Perfect. Can you feel that? And can you feel this? Lovely. Okay, we have 10 fingers, which is nice. I'm gonna go ahead and check your cap refill here. Okay. Perfect. Well, cap refill is less than 2 seconds, and then I'm gonna go ahead and we're just gonna check your pulse here again, okay? Perfect. Well, they are nice and even and nice and strong. So I'm gonna go ahead and have you wiggle your fingers. Can you move your wrists? Perfect. Do you have any tingling, numbness when you do that? No? Can you bend at your elbows? Any pain or tingling or numbing when you do that? Perfect. Can you reach above your shoulders? Perfect. Any pain when you're doing that? Perfect. So I'm gonna have you lower your arms down, and then can you shrug your shoulders? Awesome. And then we're gonna go back up to the neck a little bit with that range of motion. Can you go side to side? Do you have any pain when you're doing that? And can you look down and then look back up? Do you have any pain when you're doing that? Perfect. Okay. So overall, I could hear your S1 and S2 of your heart. They were nice and equal and strong. Your lungs were cleared. You're breathing unlabored. And your cap refill is less than 2 seconds. Skin color is nice and even. Your pulses on both sides are nice and strong. Range of motion and fine motors are really good, not experiencing any pain or anything like that. Your muscles on both sides of your arms are nice and equal, and they're symmetrical to you. And your chest is normal and symmetrical to you as well. So I'm gonna go ahead and listen to your belly. So I'm just gonna lay you back here a little bit. And then can you tell me how is your appetite?
Pretty well.
Pretty well. Are you eating 3 meals a day?
Mm-hmm.
Yeah? Okay. And can you tell me when your last bowel movement was?
This morning.
This morning. And what color was it?
Brown.
Brown. And then was it formed, loose, diarrhea?
Formed.
Formed? Okay. Do you mind if I go ahead and lift up your shirt a little bit? Okay, just pull those down just a little there. Okay. Well, your skin color on your tummy looks good. No redness, no lumps, no or bruises that I can see. So I'm gonna go ahead and listen, okay? little bit. Perfect. Well, your bowels sound good. You do sound hungry. So maybe after this you can get some food. All right. So I'm gonna go ahead and I'm going to palpate your stomach. Okay. So you're just gonna let me know if that's tender at all. Any pain? No. Check your bladder here. Okay. Well, your skin color is nice and even. No bruises, redness, wounds, and it's nice and flat, not distended at all, which is good. So we can go ahead and we can put your shirt down. So next we're going to go into your perineum. Before we do that, I'll just ask you some questions before we get started on that, okay? How often are you going to the bathroom?
Every couple hours.
Every couple of hours. Do you have any pain, itching, burning when you're going to the bathroom? And can you tell me what color your urine is?
Light yellow.
Like a light yellow, okay. And then do you notice any foul odors, any sweet smells? No? And then do you notice any sediment in the toilet when you're going? No? Okay. And then how much water are you drinking a day?
60 ounces.
16? Perfect. Okay, well, I'm going to go ahead and are you okay if we expose you a little bit? Alrighty. Well, we're going to get you uncovered. Let's get you uncovered here. Alright, so I'm going to get your gown lifted up, okay? And then I'm going to lay your legs out a little bit. Alright, so I'm going to go ahead and touch you. Your skin does look nice and even. There is no redness, no wounds, no rashes. Okay, I'm going to turn you over just a little bit. Okay, well, your back and your bottom have no redness, no sores or wounds. I'm going to lay you back down. Okay, so get you covered back up here, okay? Okay. All right, so we're gonna move into your legs now. Is that okay? All right, so I'm gonna go ahead and just take a look at them. No redness, no rashes or anything like that. You do have a bruise here. Did you fall down on your knees? Yeah. Do you do any sports?
Seasonal.
Seasonal? Okay. Well, you're nice and warm to the feel. And then just have any tenderness when I push down anywhere? How about down here? Anything on your ankles or your feet? Okay. Well, you have no swelling or edema or anything like that. Can you wiggle your toes for me? And can you roll your ankles? Can you bend them forward and back? Perfect. And then can you lift this leg up to your knee? Perfect. And you could do that one too. Bend your knee. Okay. And then can you bend your knee to your chest? Okay. And how about the other leg? Okay. Do you experience any pain, tingling, numbness when you do that at all? No? Okay. I'm gonna go ahead and take your socks off. I'm gonna check your toes and your pulses, okay? Okay, well you have 10 toes. That's good. Okay, well your pulses on both sides are nice and even and strong. Okay, well cap refill is less than 2 seconds is what we want to see. Okay, and then can you feel this? Can you feel that?
Mm-hmm.
Can you feel that?
Mm-hmm.
Can you feel that?
Mm-hmm.
Can you feel that?
Yep.
Can you feel that?
Yeah.
Yeah? Perfect. Okay. Well, we're gonna go ahead and I'm gonna lower the bed and I'm gonna have you kind of sit on the edge of the bed. I'm just gonna see how you do sit in and then just walk in a few steps to look at your gait and your movement, okay? Okay, we'll go ahead and sit on the edge of the bed. Okay, doing that, do you experience any lightheadedness, anything like that? Okay, can you go ahead and stand up for me? Are you in any pain? Lightheadedness? No? Okay. All right, so I'm gonna have you walk to me and then walk back to the bed. Perfect, okay. And then, did you have any pain while doing that at all?
Mm-hmm.
Nope, okay. Well, you can go ahead and lay back down in bed. I am done with your head to toe assessment and then we'll, we want to lift that up a little bit for you. And then, so I'm just gonna get out of your hair. So here's that call light for you. If you need anything, just hit that call light. Get your table back to you. Do you have any questions for me before I go?
Mm-hmm.
No? Okay. Alrighty, well, just hit that call light if you need me, okay?
Okay.
Alright, thank you.